All right, I got Dr. Jeffrey Gross on the show today. He is the founder of Recelebrate. He's a pioneer in regenerative medicine and stem cells. Dr. Gross, welcome to the show, brother.
Hey, thanks so much for having me. Appreciate it.
I'm super excited to jump into things with you. You're the first doctor, first expert I've ever had on the show talking about stem cells. So this is going to be really neat. And when I was doing my research on you, I noticed that you have a background as being a neurosurgeon. And when I think about that, I'm like, wow, that's like a pretty high ticket, place to be in the field of medicine. And yet you switched to stem cells. So what happened? Was there like a day you realized like this is the way I want to go, this route of regenerative medicine?
It kind of, I mean, it was grinding on me, having practiced neurosurgery, especially as a spine fellowship neurosurgeon doing tons of neck and back work. I've worked my whole career to try to not do surgery. So we try everything else first. And I watched patients just get frustrated. Hey, doc, therapy wasn't enough for me. Meds aren't enough. Cortisone injections aren't working. And we start to talk surgery. We're like, yeah, I really don't want screws and rods in my back. And I'm like, yeah, I kind of don't want to give them to you either. And there was this big gap to fill between the first line stuff and the more severe surgical stuff. And patients would ask, hey, what about lasers? What about stem cells? What about and finally enough of that rang through to me, and I went back and got retrained about 5.5 years ago, and did the work, did the homework, do the reading, got the journals, got the books, did the courses, and now I it's opened up a whole new world for me and for the patients that pass through my office.
Yeah, now you literally don't have to do surgery because you're helping them from the root cause. They don't need to get fusions. They don't need to get screws. You can actually regenerate. And I think you're going to talk about the spine and the neck and all that. So I'm excited to hear about that. So talk about stem cells. And, I'm curious I have my own idea of what stem cells are as a biohacker and a health nut, but what are they really? And what's some of the confusion of like what they can do actually and what they can't do?
So great question, and I'm a biohacker too. So I've enjoyed participating, not just delivering. But when we use the word stem cell, we're really talking about regenerative medicine, which is tapping back into the body's own innate ability to create itself, or recreate itself, or repair itself, or all those things, because they're in the same ballpark. And there are different levels of that can be delivered on a clinical basis, meaning to people. And it can start as simple as PRP, platelet-rich plasma, which is a very common approach where you take your own blood, spin it in a centrifuge at a doctor's office, pull out the growth factor plasma, and re-deliver it maybe to an elbow for tennis elbow or some other area. And usually that's done multiple times. That's kind of 101 of regenerative medicine. Kind of the advanced course would be stem cells. And these are the cells that are making those growth factors in the first place. These are the cells that created us way back when we were inside of our mothers and helped us grow in those first years until we were an adult. And since we're an adult, these are the cells that help divide into our other cells, whether they be a bone, a muscle, a liver, and maintain us and repair us. I mean, you think about it, our liver is regenerating all the time. We make new skin cells and cornea cells on our eyes and hair and things like this. This is an ongoing thing. However, as we are exposed to our environment, and this, some people say as we age, but really age is an accumulation of this exposure and an inflammatory defense, our cells just don't heal as quickly and we don't repair as well. So we turn to our stem cells for the best help we can get, but they also get exposed. So when we look into the clinical sources of stem cells, they can come from ourselves. They can be harvested from us. Most often our bone marrow is the richest source, but there are other tissues. Or from perinatal sources, meaning from what used to be trash is now treasure. So a mother delivers a child by C-section. Instead of throwing away the umbilical cord, placenta, amniotic fluid, we can keep it. And there are many labs in this country, FDA approved and compliant labs, mind you, that prepare these biologics for us. Sometimes we refer to them as products, but they're only a product to an extent that a person made them. And that can include stem cells. So these cells are young, they're unadulterated, they're not exposed to the world. Like our cells might have been, especially if we're older like me. But there's even one more step beyond stem cells because, and I appreciate, Joel, you just letting me ramble if that's okay.
Please.
but the research has shown that if these cells are delivered to a person, extra stem cells, they only last about 10 to 14 days, but the benefits last many months, if not ongoing. And the reason for that is the stem cells that are delivered give cell signaling smaller particles that we call nanoparticles or exosomes. And they're not cells, but they contain highly concentrated growth factors and microRNAs and heat shock proteins and survival proteins that go into our cells and our stem cells to activate them to juice up the regenerative process, reactivate, and help us heal like we were when we were more youthful. So when we use the phrase stem cell medicine, we're talking about all these things.
Okay, wow. When you were talking about stem cells and the placenta, for example, when I was having, not me, but when we were having our second child, I was looking at potentially, banking my wife's placenta. Or there's another option. I think if when my oldest son, who's now 9, lost his first tooth, I was thinking, oh, well, maybe I know there's banks where you can do this. But one of the things that turned me off from this was that the FDA looks over all of this. And from what I discovered, they may not allow me at a later time to get that. If I say, hey, I need these stem cells for this reason, they own it. It's like their property. And I'm like, I'm not going to do this. So I'm curious, has that changed now? Or what do you think? Or what do you recommend? Or what are some of the stem cells that you will harvest for, like someone like me comes in and Doc, I got a neck injury. I got a spine injury. Can you help me? Where are you harvesting those stem cells?
So great question. I want to unpack some of it just so we're all on the same page, if that's okay.
Yeah.
The FDA does not regulate the practice of medicine. However, they do have jurisdiction on what claims can be made, what can be said as to what cures or treats a disease or condition. So just for full compliance here, anything I discuss today is for academic purposes, educational purposes, or my own experience, and is not meant to advertise a claim. And when people come in the office, I make that clear, right? The FDA does not say what's legal and illegal to do as long as the claims are not made or made in conjunction with they say what we can say. I'll let you draw your own conclusions from that.
I mean, I think anybody who's listening to this right now gets it. I mean, the last 2 to 3 years, the only buddy that can cure any disease is a Western doctor. So, yeah, we know exactly what the FDA does and how they suppress information. But go on, Dr. Gross. Yeah.
Okay. Well, for all the listeners, if I disappear, please start looking in the desert for freshly dug holes because I'm sure I'll be there. But so as long as we, educate our patients, give them informed consent, explain the pros and cons, and let them be part of the decision as to what we can offer and from all our alternatives, because honestly, sometimes surgery is the right thing, hopefully less and less. We're doing the right thing, and we're following the Hippocratic Oath, as I always have, as most doctors do.
Would you recommend then, on that note, sorry to cut you off, would you recommend then, is that a viable solution nowadays to bank the placenta? Do you see that as a good, or even the teeth of my kids as they're falling out? Are those good strategies if we want to harvest stem cells for potential later use?
Yeah. So if you're sold on your own stuff as an adult, there are ways to harvest your tissue right now. However, it does make sense to bank your child's umbilical cord. I'm not aware of the tooth one, but when we talk about stem cells, we're talking about mesenchymal stem cells or MSCs. Now, you don't need to remember that, but it's usually more the connective and the endocrine tissues of our body that we're tapping into. A tooth has a different type of germline. So I probably need to read up more on that, but I don't think you can use that for everything unless you reverse that stem cell backwards, and that's a little too out there right now. It's happening, but we're not ready for that. We're not doing that, at least in the clinical setting.
Yeah.
So the umbilical cord is great because if your child hopefully never gets anything like a leukemia, then you can wipe out their entire bone marrow, kill the leukemia, and replace their bone marrow from cells from that umbilical cord. It's a match. It's from them, right?
Wow.
So sorry, Siri thinks I'm talking to her, but
And
so I'm a
so
fan. I'm a fan of that. However, when we talk about people like you and me, and I put us in the same age group, Joel, I'm sorry. I'm sure
I'm
I'm older, but
41. So
yeah,
yeah.
I'm 57. So I can
Oh, you
tell
look
you that
great. It must be the stem cells.
it must be. I don't want those old cells put back in me of my own. Now, if you bank them at a young age, there is a group, the Stem Cell Surgical Network, that does some banking and will populate your cells in culture, meaning divide, let them divide and make more of them. So there is a group that does that, and you can use your own stuff. I like the stuff fresh out of the womb. That's the best stuff in my mind. Most active, not adulterated, not exposed to anything. So it's off the shelf. It's easy to get. It's really kind of simple.
Okay. Very cool. That's what I was wondering. It is easy to get, and they're easy to get. It's plentiful,
Yeah.
so that's good to know. And then, what are some of the things that people are coming to see you for, or the conditions? Like, what do you see as just, this is the most viable solution that stem cells would work beautifully, or exosomes?
So my low hanging fruit for these things are people with a joint or spine problem, because they tend to have the most benefit there to help prevent the need for surgery or delay the need for surgery. They reduce inflammation powerfully. It's probably the most logical, approach to anti-inflammatory effect of the cells. And we have great examples of restoring the body's ability to recreate the very joint it made in the first place. So we tap back into the original factory equipment. We
Wow.
stimulate the stem cells that produce the cartilage proteins, whether it's a meniscus in the knee or a disc in the spine. We're showing that we can reactivate that.
Wow, that's powerful. Is there a testimonial or anything that stands out to you, like where someone came in and they're like, there's just probably no way you can heal me, but I figured I'd give it a try anyways, and lo and behold, they got better. By the way, if the FDA is listening, yes, we know you cannot heal, cure disease, but I'm sorry, you added stem cells into their life and they got better. Let's just say that.
Yeah, so I'm more. You mentioned exosomes, and I'll tap back into that because really I'm using more exosomes these days than cells. Exosomes, I can give a more significant concentrated dose. They last longer. They travel better. They're easier to handle. In the office, I have a -30 freezer. Cells have to be kept in a -80, which I also have, but um, they're just a lot easier to deal with. Plus, they're about half the cost. And I haven't seen any reduction in benefits in my experience. So I'm a big exosome fan. So exosome again are the small stem cell activators. So we've been delivering them. I think my best case is the knee cases, particularly. I have a lot of ladies, who like to wear high heels, have trouble walking on the heels or up and down the stairs, have pain getting out of a chair. That's probably my most frequent group, and we have people in their 70s who are getting benefits. And once you slow down, you stop using your muscles, you stop using your bones, and you stop doing the weight bearing activities. You lose your muscle mass, you lose your bone density, and that reduces your longevity. So just by helping someone's knee, we're probably helping them live longer.
Yeah, 100%. I mean, you just think about too, just depression when you're not moving, you're not active. What happens? You're sitting down, you're inside. No, that movement creates lethargy, atrophy. You actually just become depressed, and then that goes down in a whole nother cycle. So just
Right.
fixing someone's knee makes them amble, makes them strong. I mean, that's actually a huge
Yeah,
jump off. That makes sense. You
totally.
mentioned, and I know you have a really deep background within the spine prior to doing stem cells. How has that affected what you do in stem cell in the world of exosomes and stem cells, and what are some of the things that you're specifically able to target better than some of the other doctors out there?
Yeah, we have a new tool in our kit of things we can offer someone. So when I have people with low back pain, for example, where they have a problem with a disc or discs, or low back pain with a problem from some of the joints of the low back, or even both, we now have an approach where we can, through injection or injections, usually one time, when I said plural, it means at one time, we can improve the health of that joint, reduce the inflammation, which is one of the things driving the source of pain, and help improve the health of that disc, improve the nutrients, the water content, the protein content, the shock absorber nature, or what we like to call the viscoelasticity of the disc. And with that, we're improving the patient's overall function and reducing pain, and hopefully reducing the need for surgery, right?
Yeah. Yeah. How much? Because you mentioned it's become a lot more affordable, and I don't even know anymore. I know, like, from what I've heard, like full body stem cell treatments are like $5,000 in Mexico. But
Mhm.
what's some of these exosome or just some of these very joint specific? What can people expect if they're doing some kind of treatment like that?
Yeah, so like a common approach would be to address one joint or one disc, for example. We have to do this at a surgery center because we follow the French protocol. If I could take a little diversion,
Please.
Philippe Hernigau in France has been doing this for nearly 20 years. So they published 2 years ago 15-year follow up. So we're way behind the curve here in the U.S. But we follow their protocol, and they inject right adjacent to the joint or the disc or the meniscus or the soft structures, because they're injecting these near this into the stem cell population of the bone marrow, because that's where the party is, that's where the biology is, that's where the action is. So we put the exosomes there. It enhances the activity of the cells there, reduces inflammation, improves the protein production, and these proteins make the joint. They make collagen. They make all the cross-linked proteins in the meniscus or the disc, for example. So we follow that protocol. So this is nothing I made up. I just looked for the best practices and pulled them all together. So we will do that at a surgery center because it is a bone injection under light sedation. No one has to be out for this, and it's a short procedure. So because the surgery center and the anesthesiologist for the sedation, and I have to buy the biologics from the different FDA compliant labs, doing a knee is usually a 2-dose intervention, one above, one below the knee joint. And something like that is probably just under $10,000, and most people either have a health savings account where they can use that money, or they just have figured out that 10,000 with a great chance of avoiding a knee replacement avoids the downtime, the pain, the suffering, even though their insurance company, their health insurance company, will pay for their replacement. They figure out the better option for themselves.
Yeah. Speaking of that, what about, do you know about health shares? Will they cover some of these specific? I don't know if you've ever had that. And, there's like Good Samaritan Ministries and some of the health shares. I wonder if they will cover anything.
Don't know, and maybe afterwards we can investigate it together, because
Yeah.
if I
I'll try to
can
find out.
find people and make it available to them, this has been a great joy for me in the last couple of years, and sort of having a second wind in my practice. Being, instead of doing things I've been doing for 25 years, trained by people who did them for 25 years before, and looking back and say, spine surgery really hasn't changed drastically in 50, 60 years.
Yeah.
I like it.
Yeah. Yeah. You're truly helping people, I think, in a big way. And that's what I think that's what you're seeing. For, if I were to come to you and, I'm like, hey, I just want to be in better health. My joints, I'm getting old. I'm 41. Things are going apart. Would there be like a time where I need to come back and see you like every 15 years, you think? Like, just kind of keep doing it? Or are the effects pretty darn good? Depending on,
So
obviously, depending on my exposure to toxins, the lifestyle, like you
right.
said, our exposure is huge, but
Sure. Well, like I said, I've been doing this about 5 years and change, and we have not yet had someone need to come back for another joint procedure. But you're right. We keep using the joints. They're going to have, some newly accumulated degeneration. So at some point, you may need to come back for more regeneration. The French protocol is clear that at least at the 15-year mark, only about 15 to 16% of those people have fallen off and needed to reconsider treatment. So I think we look for at least that kind of response here.
That's amazing. That's really cool. We're both biohackers, so if we can amplify or, even go to the maximum on a treatment, what are some things that you like to have clients and patients do maybe to amplify their stem cell procedure? I know some people are doing things post-treatment or even pre-treatment.
Yeah.
Yeah, what are some things that you like to do?
Well, when people meet with me first, and most of my people do travel here to the Las Vegas area. We're in Henderson, which is a suburb. Um, Most of the work we do is like this through a Zoom call. We get them, we educate them. We go through their lifestyle, their supplements, their sleep, their exercise, their diet, everything, because I want their body to be the best receiving environment for what we're going to do. If we're going to spend a few $1,000s on something, by gosh, let's help at work. Let's do that. So I really like to get them on a regimen, and it's very simple. Most of this over the counter supplements, things like that, and we get them going, and we want to keep them on it. So I monitor and we do track the results of these things because we, like you said, as biohackers, we're not just doing joints. We have the anti-aging crowd that come in, and we do IVs on a repetitive basis, and we look at biological age tests. I know you've had some people on that do that. We look to inflammatory markers, how much inflammation is in the bloodstream in different ways. And we look at health metrics, wearable tech, heart rate variability. We had one guy that I love to tell the story. So very fit gentleman, biohacker, anti-ager, came in. We did IV exosomes, and most people feel a difference, especially the first time. They really feel energy and awareness and clarity and effervescence and recover faster, what have you. He texted me back, said, after about a week, he really didn't notice much, but a couple of days later, he sent me a screenshot of his HRV, which had been running in the 60s for months, and he's very, very active, and it shot up to the 90s.
Wow.
He goes, I may not feel this, but look what it's doing. Yeah.
Yeah, that's massive. Anybody that knows or tracks their HRV to get, honestly, to go up 5 or 10 points would on a rate. If your numbers are habitually 60, if you were just to go up 5 points, it would be a big deal. So the fact that he shot up 30 points like pretty much overnight is wow. That's a huge showing. That's a huge testament to the score of his resiliency and how much it improved. Really.
Yeah. I was amazed by that. So not everyone feels something necessarily with the IV, but we know it's bioactive. It's doing something, right? It's reducing inflammation, improving cellular function, and when you improve your cell function, you're improving your function. So he's seen that in that sensitive health metric.
Yeah, that's really cool. I was thinking as you were talking earlier about heat shock proteins and these stem cells. We naturally make them and produce them. What are some ways that we can naturally produce them? I know, one of the things we've heard is that fasting for 72 hours your body will start to regenerate new stem cells. Other than that, though, I don't know. Is there anything else that you would recommend?
Yeah, these all fall under the category of what we call hormesis. You've probably, I'm sure, heard that word. And this is a slight to moderate stress on the body, its cells, to build more resilience. So calorie restriction, intermittent feeding / fasting, and full fasting, whether it be 24 hours and even up to 72, where you do get a reset of your immune system and some of those stem cells, is fantastic for survival. Survival means your body takes a chance to say, you know what, I'm going to kill off all these senescent, non-working zombie cells because they're taking up space and using resources. And we're going to make a bunch of new ones and try to survive. The other ways you can do that is through exercise, especially high intensity and interval training. If you're talking about building bone density and muscle mass, which are the muscles of longevity, or the organs of longevity rather, then weight-bearing exercise, resistance training, and then sauna, repetitive sauna use, cold plunges. These are all forms of hormesis that give us a little bit of stress that causes our cells to make these heat shock and cold shock proteins, which are very primitive survival proteins that go to the nucleus of the cell and tell the very restorative, reparative, youthful genes to get to work. and save this person. Get rid of the junk, clear out the closet. Let's go.
Very good. Okay, I did not realize that these hormesis factors were all things that can help with stem cell creation.
Oh
That's
yeah.
really cool. I was curious, have you done anything you mentioned age tests and longevity, and that's your specialty, regenerative medicine and longevity. Have you done any tests? And if you have you done anything other than stem cells, or maybe stem cells was one of them? But I'd be curious to know if you did anything that we just mentioned, the blue zone diet or meditation or sauna, and you saw a massive reversal in your age, or have you done any testing to show that?
So I do so many different things and I play around because I experiment on myself. So I do too many things where I can't get good data on that. But I do age tests. I do health metrics, track health metrics now, and the latest version of the, or even the prior version now of the uh, Apple operating system for those iPhone users out there does track HRV. Earlier ones did not. I had to buy an app to do it.
Hmm.
So you can do that on your Apple Watch now through your. It's one of the health metrics. Um, I have done both stem cells and exosomes, and except for the first 2 weeks, I find them relatively similar in results. So I'm sticking with the exosomes. It's half the price.
Okay.
Um, and like I said, easier to handle. I can give a more concentrated dose. I think that the results we're seeing in some other areas are just exciting. We have some cosmetic things we do for rejuvenating facial skin appearance and t- tightness, elasticity. We do some procedures for thinning hair. I've had that done a number of times myself. As long as there are follicles, we can help reduce inflammation and improve that. We so personally, those are my things. I'm a big believer in circadian rhythm. We have a light cycle and a dark cycle, like a plant. We wake up in the morning. There's light outside. The light hits our eyes. We secrete the stress hormone cortisol so we can fight the day. At the end of the day, we need to shut it down. We need to go into the dark cycle and repair. And we need a couple things to do that. We need dark, cool, restful, mindfulness, meditation, quiet down, and melatonin. Even if you have no problem sleeping, because everyone think, oh, melatonin is for people who have trouble sleeping. Well, it can help you sleep and sleep deeper, but it's also the nighttime dark phase hormone. It does cellular repair activities during the night, and it's probably deficient in so many people because we really don't make much after or post puberty. So if you ever
Wow.
had a teenage kid, I don't know if you have one yet, if you're, but if you ever try to wake a teenage kid from sleep, man, they're hibernating, man. They're hard to get up. And one of the reasons is that they sleep deeply with that melatonin. So if you want to sleep deeper and get more out of your repair during the night, if you want, it helps you lose weight. I think you had a thing on that once.
Yeah.
And so many other things. Now they found polycystic ovary syndrome may have a relation to not having enough melatonin. So take melatonin at night. Simple supplement over the counter, easy to do.
Man, that's a great one. And I was just, one of my mentors was talking about that just recently in terms of the anti-aging. I love that you mentioned that. It's such an easy fix over the counter, but I don't think about it. Sometimes we're doing so much other stuff, we forget some of those simple ones because it's just melatonin. And like you said, I sleep well, so I can always improve. But my sleep in general is pretty good, so it's not something I think about a lot. Then would you just do? Is that something you'd say? Like just do a daily dose,
Do it.
1.5 milligrams, just something like a little dose, or
I'm doing 5 milligrams to 10 milligrams at night, um, and I sleep deep. I have a sleep app. I track Apple Watch and phone, and you can see my sleep ratings improve. My HRV improves, even though I wake up just as rested. It's doing more for me. I'm fairly convinced of that.
yeah. Okay, that's great. That's great to know. Other than stem cells, what else is exciting you about the anti-aging, longevity, regenerative medicine space?
So it's a thing, right? You can add 10 years to your life, and not just add years. You can add healthy quality years. If you the earlier you start and the more you do consistently, you can still have a weekend where you go out of town and have a little too much fun, as long as most of your time and effort is doing some simple and easy things. So you got to move. Exercise is the one thing you can do to maintain your cognition, improve your muscles and bone density, and take supplements. It's very simple. I start everyone out. Most people come in, oh, I take a multivitamin. Well, that's okay for preventing malnutrition, but it's not doing much for optimal nutrition. So I start everyone out on, I'll call it the 5 basics anti-inflammatories. Vitamin D3. The sun doesn't make enough for you. It doesn't convert enough for you. You got to take
Not even in Vegas, Dr. Jeffrey Gross?
Well, first, if I was out that much in the sun in Vegas during the heat, I'd have other problems, right?
Yeah.
But you remember, the sun doesn't really make it. It converts vitamin D2 to vitamin D3. How many doctors do vitamin D2 levels to see what you got anyway? So take your vitamin D3. It's easy to do. It's over the counter. I take 5,000 international units a day. Probiotics, I think Siri found something on the way. She really wants to be involved in this podcast.
They're listening to you. They're listening to you, Dr. Gross. You got to go airplane mode. The FDA.
Yeah, theater mode. That's right. I forgot. Theater mode. There we go.
Yeah,
okay, so
this one.
I take probiotics. I recommend probiotics. I think, we didn't learn this in med school. At least I didn't. And people will come in, oh, I take this probiotic. Yeah, great. But I read up on it. I know it. The bacteria that are invited guests do things for us. They help us digest certain phytonutrients that we can't do a good job with, that have significant anti-inflammatory relations to brain health and other parts of our body. I would focus on oral health. Flossing can add a year or two to your life by reducing inflammation in your gums that goes right into your heart and heart valves. So back to supplements, we got probiotics, vitamin D3. We talked about melatonin. I'm a big fan of magnesium at night. I don't think we get enough in our diet. It comes mainly through green vegetables, and frankly, it's just hard to eat enough green vegetables all day. And I'm a big fan of fish oil, so I recommend 1,000 milligrams 3 times a day.
What's a brand of fish oil you like? I know there's a lot of controversy on the fact that it goes rancid and that kind of stuff. Is there one that you like and trust?
Listen, I don't promote any brands at this time. I'm not the best businessman. Maybe I should, but if it smells bad, don't take it. But I've bought it at a big warehouse store. I've bought it online. I've paid 3 times as much for one than another. I don't know that there's a difference. I would have to do all kinds of lab tests on myself on a repeated basis, and it just seems overkill. Just take it. Start by taking it.
Okay. Okay. Sage advice. Okay, cool. What about you? Any new and exciting projects that you're working on that you're excited about coming up?
Yeah, no, thanks for asking. So I am I've been working on a book for a long time, but I'm a little OCD. That's an understatement. I'm very OCD, so I keep including things in the manuscript, and I feel, oh, there's something new, and because I read all the time. So this is a how-to guide on anti-aging and anti-inflammation, what it all means. It's sort of an education and a guided, workbook. But someone close to me, very smart, recently said, hey, why don't you just make a simple course to get people started? So I'm going to come out with a course hopefully very soon. If anyone's interested, you can go to, it's going to be Young Again Method /longevity, and we'll put you on a list and we'll send you a little something. But hopefully that'll be easy and fun.
Yeah, very cool. I want to wrap things up a little bit and ask you some final round questions. But before I do, just anything that I didn't ask you that you wish I had.
Well, I can make a long list. I mean, there's so many things that regenerative medicine has applications for. I talked about some of the cosmetic and the IV that we approach to help people with autoimmune or hyperinflammatory syndromes. We've done some. We have a breathing treatment with the exosomes for people that have lung issues related to pandemic type situations. I don't want to go too much into that because I'm sure I'll have knocks on my door from people that I shouldn't. And then we have a population of patients with dry eye syndrome, whether they've had LASIK or some other issue, and we treat the glands in the eyelid. It's very simple, actually. And we have people with some sexual dysfunction, we can do shots for girls and boys.
Nice. The eye, my father, approaching 70, he's got macular degeneration. Is that something that you guys do well with as well?
It's not something I have addressed personally. There are people working on that. It's not something I'd want to do directly into the eye. The question is, if there's an inflammatory component, then the IV may have benefit, which causes me to add one little tidbit. Comparing exosomes to stem cells, anything involving the nervous system, so recovery from stroke, dealing with the inflammatory changes in Alzheimer's disease or other issues, or helping to at least, the IV exosomes will travel through the blood-brain barrier into the nervous system. Stem cells are too big. They really don't penetrate well. Now, stem cells can make their own exosomes that can be delivered, but why not cut out the middleman? The stem cells are just a delivery vehicle in that setting.
Okay. Very cool. Yeah, I was thinking about that. Even when you mentioned before that, I was thinking about people with MS, and I have no idea if there's been stem cells that have shown help
Yes.
in that area. Yeah.
Yes, there's an inflammatory component of MS. If you look at it, it's inflammation around the veins in the brain. So anything with an inflammatory component can potentially be affected in a good way by the anti-inflammatory benefits of regenerative medicine.
Wow. Okay, that's exciting. Yeah, that's really neat. Okay, cool. Let's jump into some final round questions. We'll wrap it up and have everybody, if they want to connect with you and learn more about you, you can tell them where to find you. And
Sure.
I think just where to ask questions. Can you help me? Because as the more we're talking, I'm thinking, well, what about this and what about this? And I'm sure they can just contact your people and kind of find out if that's a viable solution.
Sure.
For them.
Yeah, happy to.
Dr. Gross, I'm curious, was there a choice or maybe some choices that you made in your life that you think made you who you are today?
I'm sure there are. I mean, I know I went into medicine because it was sort of the final frontier, and I had the good fortune of working with a wonderful neurologist in the Bay Area during my college years, Stephen Holtz, who inspired me into the nervous system, and I got interested in the brain, and then professors during my residency, like Dr. Benzel, stimulated my desire and love of the spine. But I do remember as a young child at a camp I attended, a child fell down and had a big scalp laceration, and of course as a kids we said he cracked his head open. I don't know if anything was actually, the skull was fractured or what have you, but I got inspired then. Like, it was, I'll never forget that. I was probably 5, so I think that's part of it.
That's really cool. Obviously, you're doing so much in the wellness and health space. I'm curious, who inspires you?
Well, I'm close with some of your guests in the past. Susie Bratton has been an amazing mentor and colleague. Ben Azadi. We mentioned off screen some of the guys who have come before me. Dr. Hernegau in France, who's done these studies for many years. A colleague of mine in Los Angeles, Peter Fields, Dr. Fields, and others have. I stand on their shoulders when I pick the best practices to bring together and offer to people.
Yeah, that's great. I'm a big reader. Are there any books? There's like a top 1 to 3 books that just change your life, and you'd recommend go out and read that book. It'll probably do the same for you.
Well, I keep trying to finish Les Miserables because it's so deep and
That's
meaningful.
A tough one, man. That's
it's
a tough one.
it's thick, man. It's really thick, but
I gave up.
It's amazing. But listen, Tim Ferriss. Years ago, I read The 4-Hour Workweek, and it has caused me to make so many improvements in my business and efficiencies, and made me look at things in such a way. We waste a lot of time doing a bunch of old traditional things. Spine surgery might be one of them, where there are better options just because we were trained a certain way or we always did something a certain way. So that's one of my favorites.
Yeah, Tim Ferriss is great. That was that book, same thing, inspired me, however 10 years ago to consider entrepreneurship, and I never even had it in my mind. So yeah.
Awesome.
What about last 2 questions? We'll wrap it up. Any, this is gonna be great for you as a biohacker, but any rituals, hacks, or practices that you like to do on a regular basis?
Oh gosh. So, some of them, I think my favorite things are, I've really become excellent at intermittent feeding. I call it intermittent feeding because we're not supposed to eat in the dark phase. So you're not fasting. You're just not supposed to eat. A fasting is when you're, in my mind, when you're not eating when you should be eating. So I've become really good at it. I think it makes a huge difference in my energy, my function, my metabolism, my health. So I've been very regimented, and I have a very easy 16 to 18 hour non-eating window now. Now I will have an acaloric beverage in the morning to get some hydration and fill the tank. Um, Whether it's black coffee or something like that, it's with no calories. So that's the key. Second is protein. We don't get enough protein as Americans, as humans, and as people who should be really working to maintain muscle mass, even if we're not, looking to gain muscle. Maintenance of muscle is a key factor in longevity. So protein supplementation is important, and I really work hard to get 140 to 160 grams of protein a day. You heard on Star Trek, we are carbon-based life forms. No, we are nitrogen-based life forms. Carbon gets us around. We're nitrogen-based life forms.
Interesting. I've never heard anybody say that. Okay, very cool. I like that. Last but not least, Dr. Jeffrey Gross, where can people find you, connect with you, learn more about what you're doing, or even connect with you on social media?
Great. Thank you for that. All my channels are called Recelebrate, ReCellEbrate. Find us on Instagram, TikTok. I have YouTube if you want to watch a video here or two or follow for tips. We're doing some things toward more just geared towards longevity on the Instagram channel called Get Young Again, but the website is Young Again Method /longevity if you want some more information there. And Recelebrate has a pathway to get to the office if you want to talk to me. I love to meet new people. We take the time. Everyone's different. It's precision medicine. We look at everything you have and you need, and everyone is different in some way.
Yeah, amazing. Dr. Jeffrey Gross, I appreciate you so much, brother. Thank you.
Thank you. Appreciate being here.